don't hate orthodontics. You just learned it the wrong way. Most dental students study orthodontics as separate topics: classification, appliances, biomechanics, and that's exactly why nothing connects. So I turned orthodontics into one simple system, using MINDMAPS. Note, these mind maps are for revision only. Always depend on your lectures and textbooks. This is the full picture. Basics, then classification, then cephalometrics, then space analysis, then appliances, and finally treatment, surgery, retention, and Anchorage. Everything is connected. Here's how it works. First, understand timing and why treatment matters. Then classify the case. Is it dental or skeletal? And how severe? Then analyze cephalometrics, SNA, SNB, relationships, landmarks. Then check space. Is it enough or not? Do we extract or expand? Based on that, choose the appliance, removable, fixed, or functional. And finally, complete the treatment. Maybe surgery, then retention with proper Anchorage. This is not random anymore. It's one connected system. How to use mind maps. Print them and keep them in front of you. Every time you study a topic, connect it back to the map. Don't treat it as fixed. Update it with your lectures, textbooks, and your professor's notes. Because sources can differ, and your lecture is your main reference. Then use active recall. Try to explain everything out loud. Don't memorize. Rebuild it in your mind every time. Before the exam, review your map and recall everything. If you can redraw it from memory, you're ready. I uploaded all the mind maps. Check the description. Orthodontics isn't complicated. You just needed to see the big picture. If this helped you, send it to someone struggling with orthodontics. And follow for more mind maps and study hacks.